A very warm welcome to all the participants joining us from across India and beyond. I am Sanjita Biswas, Deputy Manager from Sphere India. I'm delighted to welcome you all today's thematic webinar on invisible disasters tackling air pollution through resilient and risk informed systems, organized under Sphere India Academy. As winter deepens across the country, the air we breathe is increasingly becoming invisible disaster, quite persistent and deeply harmful. Air pollution today is not just an environmental or health issue, it is a slow onset, multi sectoral disaster that affects every aspect of human well being, urban resilience, and development. With Delhi and several cities across India experiencing hazardous air quality each year, it has become an essential to build systems that are informed, risk informed, people centered, and resilient. Against this backdrop, we are gathered here today to learn, to reflect, and collectively identify the pathways to protect communities and strengthen our preparedness. Before we begin, I request all the participants to kindly write their question in the chat box. We will take them after each session, ensuring the reflections and the queries are included in the discussion. I also request all the speakers to kindly adhere to the 15-minute limit so that we can keep the flow smooth and ensure space for interaction. We are deeply honored to have our distinguished panel of speakers with us today, each bringing unique expertise and lived experience across the environmental sciences, public health, disaster governance, communication, and mental health. It is my privilege to introduce our first speaker today for the session one, air pollution as an emerging disaster risk in India, Ms. Ananya Mahajan, research lead at the Sustainable Futures Collective. Ms. Mahajan works at the intersection of pollution, environmental governance, and public policy with strong focus on assessing health and economic impacts of poor air quality. She holds a master's degree from the Barcelona School of Economics and has previously contributed to critical research at the for Policy and Research and Inclusion Economic India Center. Her work deeply reflects the commitment towards strengthening decentralized governance and evidence based environmental decision making. We are delighted to have you, Ms. Ananya, and look forward to your reflections on understanding air pollution as silent disasters, the key health challenges it poses, the major pollution sources and meteorological factors, and how Delhi's situation mirrors the broader national trends. Over to you.
Thank you so much, Sanjita. Good afternoon, everyone. I'm going to share my slides. I've prepared a short presentation. Just one sec. Okay. Can you see my slides?
Yes, yes, it's absolutely visible.
Great. Let me just. Yeah, okay, this should be better. Okay. So like Sanjita mentioned, I'm going to be speaking about air pollution as an ongoing disaster in India. I work at the Sustainable Futures Collaborative, which is an independent research organization. To begin with, I'm going to start with the definition of a disaster as per the Disaster Management Act. A disaster is a catastrophe, mishap, calamity, or grave occurrence in any area arising from natural or man made causes or by accident or negligence, which results in substantial loss of life or human suffering, or damage to and destruction of property, or damage to or degradation of environment, and is of such a nature or magnitude as to be beyond the coping capacity of the community of the affected area. So I'm now going to build a case for why air pollution should be considered an ongoing disaster in India. Air pollution is a year-round and nationwide problem. 82% of Indians are exposed to PM 2.5 concentrations above the NAC's limit, as per a study conducted last year. Roughly 3.8 million deaths in India can be attributed to air pollution, spanning 2009 to 2019. The Indo-Gangetic Plain. So if you look at the map on your right, it's the red region spanning from Punjab in the west to West Bengal in the east. This Indo-Gangetic Plain is one of the most polluted regions in the world. So even if you look at the most polluted city rankings today, you'll find cities within the Indo-Gangetic Plain predominantly feature in these rankings. Uh, there are within India itself, there are multiple sources, and there is a lot of transboundary pollution that makes it a particularly complex regulatory challenge to deal with. And in the absence of effective regulation, there is an increasing number of cities that are not being able to comply with the national ambient air quality standards. So here we see, using a study from the that utilizes the global burden of diseases, we see air pollution features as the number one risk factor for deaths in India. So what this means is that air pollution is a predictor or a characteristic that can determine or sort of increase the likelihood of deaths in India. Um, then jumping into what the health impacts of air pollution are. So I think all of us are very familiar with what the health impacts are. There is an overwhelming amount of evidence, both globally and within India as well, that suggests that air pollution can affect almost every part of the human body. So if you turn your attention to the image on the right, this is an advisory that has been put out by the Ministry of Health and Family Welfare on Twitter. The short-term effects are plenty. We're all very familiar with this, may even be experiencing it at this point. And the long-term effects span, impacts on the nervous system, the heart, and also the respiratory system. Evidence also shows that smaller pollutants can cause a lot more harm, which is why you will see a predominant focus on PM 2.5 relative to PM 10, because PM 2.5 particles are much smaller and hence much more dangerous to the human body. Also, there are certain pollutants that are more toxic than others. So even if we say PM 2.5, PM 2.5 emanating from certain sources, from a certain combination of sources, can turn out to be a lot more toxic as compared to PM 2.5 from other sources. We also find that air pollution has adverse health impacts across all age groups. However, we also see that children and, of course, the elderly are the most susceptible. We also find that air pollution is particularly dangerous for those with pre-existing health conditions. And not only people who, of course, are already born, but prenatal exposure as well can result in adverse health impacts in utero, so low birth weight and premature birth as well. And there is recent evidence from a study as recent as last year, which shows from 10 Indian cities, which shows that air pollution linked mortality occurs even at pollution concentrations that are within the NAC's limits. So I'll use this figure to explain that better. This figure is from the 10 city study that I just alluded to in the previous slide. And what you see on the x-axis is the PM 2.5 concentrations in these 10 cities. And what you see on the y-axis is the percentage change in mortality that is linked to air pollution. And what you see here is that even within the 60 microgram per meter cube limit, we do see that there is a percentage increase of air pollution linked mortality in these 10 Indian cities. The other interesting thing that you'll also see is that the slope of this curve kind of reduces as pollution concentrations increase. So what does this mean? So this figure will explain that. So when you cap pollution to say 60 micrograms per meter cube, which is the lowest row in this graph, That is the NACS limit. You see that the percentage change in contribution, or sorry, percentage change in mortality is around 2.7, 2.8. And that sort of reduces as we increase the pollution concentration limit. So, what this means to say in simple terms is that even cities that may not be experiencing very high levels of pollution within India, say cities that have less pollution, less average pollution than Delhi, are also cities that are at high risk of experiencing adverse health impacts of air pollution. So we see that, a Delhi may have, say, something close to 30,000 annual deaths, but cities like Chennai, Bangalore, also experience, say, close to 2 to 3,000 deaths every year. So, which are not insignificant numbers. So, this goes to show that while, of course, we all have mostly turned our attention towards Delhi, there are a large number of regions outside of Delhi as well that are highly susceptible to air pollution and are already experiencing its adverse health impacts. Um, Now looking at the key sources of pollution and also the factors that contribute to exacerbating air pollution in India. So the first is, like I'd mentioned earlier, that there is a multitude of sources of air pollution in the country. These range from transport emissions coming from road, aviation, shipping, railways, etc., waste burning, due to improper waste management, industry. So we have, this can include MSMEs with low quality fuel and also large clusters of industrial areas outside cities. Of course, construction activities, which contribute a lot to dust. Power generation, which can include, large scale thermal power plants, but also smaller individualized like diesel generators. There's also biomass burning. So this includes, usage of cook stoves, chulhas, cow dung cakes and such for cooking and heating purposes within households, but also stubble burning. And we also see road dust, which not only comes from vehicular emissions, but also from, say, wear and tear of tires and such, and of course, firecrackers. So this is, sort of just a list of the key sources of pollution that we see in the country. Of course, their quantum varies with the proximity of the sources and their prevalence within cities. The other two factors that act as sort of contributors to air pollution are meteorology and topography. So meteorology can influence air pollution through temperature. So we see, when temperatures are lower, the air is more dense and it's more difficult for pollutants to disperse. The second one is wind speed. Again, lower wind speeds can make it more difficult for pollutants to disperse, and also higher, like wind can also bring in pollutants from other regions. So it can play a positive and a negative role. And of course, precipitation has a major role in, influencing air pollution with, for example, on rainy days, we see a lot less air pollution. And we're sort of seeing that play out through the cloud seeding experiments in Delhi. And thirdly is topography. So a clear example of topography is in the Indo-Gangetic Plain, within which Delhi lies as well, is bordered by the Himalayas to the north and the Vindhyas to the south, which again prevent dispersion of pollutants and making it a lot more difficult to see clearer skies. And together, I want to emphasize that both meteorology and topography influence transboundary pollution, which means, like I'd said earlier, that of course there are pollutants within that are generated within cities, but these factors, these contributing factors, can also add to transboundary pollution, further compounding, pollution that already exists within cities. And this is an example of a temperature inversion, which is how smog has accumulated over the city of Almaty. And this is, you can see very clearly how the pollutants are concentrated closer to the ground due to the air being cooler closer to the ground. Now I'm jumping into the sources of pollution within Delhi. So I explained to you the broad sources that we see across the country. This is a consolidation of this is a table that consolidates sources across from a variety of different studies, starting from the 1990s up to 2022. And while the broad buckets of pollutants remain the same, of course, the range varies a little bit, with each study. What I want you to focus on is the first three rows. So you see here that vehicular exhaust, dust from roads and construction activities, and industrial sources are sort of the three key contributors to the annual contribution. So all of the figures you see on the in the right column are annual contributors to air pollution, specifically PM 2.5 concentrations in Delhi. And then you can see at the bottom things like dust storms, which come from mostly from outside the city, agricultural residue burning, and Diwali as firecrackers are, in the larger scheme of things, very small contributors to a PM 2.5. So this is again to show that there are sources of pollution that are sort of present year round, and then there are more seasonal sources of pollution which are prevalent at certain times of the year, as we are seeing with crop residue burning and firecrackers around this time. And so now I'm going to quickly jump into the governance responses and the policy responses to these issues within Delhi and also outside. So the responses can sort of be broken down into three categories. The first generation of responses were very public interest litigation, and they were they were driven by PILs, and they were also kind of ad hoc. So these included the transition to CNG, the relocation of brick kilns outside, the borders of Delhi, and the shutting down of industries and thermal power plants within the city. The second generation was slightly more selective and sectoral. So these included the pet coke ban, the leapfrogging of vehicular emissions to BS6 from BS4 earlier than scheduled, and the, of course, transition to EVs, not just in private vehicles but also in buses. And the third generation of policy responses includes more city-centric approaches and some sort of scattergun silver bullets. So here we see the National Clean Air Program and the 15th Finance Commission that was the NCAP that was launched in 2019 and added a lot of funding and sort of behind the air quality actions. The Graded Response Action Plan, which was again a very city-centric approach. And lastly, silver bullets such as smog towers and smog guns and crop residue management techniques. And most lately, we are seeing cloud seeding efforts as well. So all of these, I want to emphasize once again, are efforts which sort of are trying to tackle year-round sources of pollution, but are at the same time also do overwhelmingly focus on seasonal sources of pollution. And lastly, I want to talk about what we should focus on going forward. So what the fourth generation of actions to build resilience to air pollution should look like. And of course, they should ideally be focusing on systemic reform. So the first is that we should plan and execute nested policy actions right from the local to the airshed level. So this will involve notification of regional airsheds, ensuring that there is coordination even across administrative boundaries along the lines of where pollutants are shared. The CAQM, which is a statutory body responsible for control of air pollution within the NCR, is a good start to that. The second is that air health needs to be made the focus of crafting air pollution mitigation actions. Health needs to be utilized in order to target exposure to the most dangerous pollutants and the pollutants that cause the most harm to human health. And that needs to be used as a means of prioritizing the pollutants that we need to focus on. The third is the building of future-ready regulators. So we need to support and strengthen the existing regulators, such as the state pollution control boards and the urban local bodies that are being used to implement a lot of the air quality actions. They need to be equipped with technical capacity and expertise, not just funds. So we have seen under NCAP that a lot of the regulators and implementation bodies have been given funding, but that is not enough. These additional aspects also need to be looked into. And the fourth is the move from palliative actions to root cause driven sectoral transformations. So an example of this is, not looking at, say, quick fix solutions that are sort of ex post, but looking at solutions ex ante that actually bring in a structural change. So, for example, focusing on crop diversification as a way of tackling stubble burning as an issue. So I'm going to end here. Thank you for your attention.
Thank you so much, Ananya, for such an opening and insightful session. Your reflection on recognizing air pollution as a slow onset disaster, the evidences and data showing what is the current air pollution scenario in India, the urgent health risk faced by the vulnerable population, and the key sources of pollution and contributive factors to air pollution in India. It has have beautifully set the context for today's discussions and deliberations. Thank you so much. If any participant has any question, they can write it down in the chat box and we can take it forward in the last, at the last. So moving forward, we have we have with us, and it's an honor to welcome our next speaker, Dr. Anju Goel, Associate Director of Air Quality Research at TERI. With over 15 years of experience in air quality management, from emission inventory analysis and air monitoring to city level management plans and capacity building, Dr. Goel brings deep scientific and technical knowledge to today's forum. She holds a BE from Delhi College of Engineering, MTech from IIT Delhi, and PhD in Environmental Engineering from the University of Surrey as a Commonwealth Scholar. Dr. Goel, we invite you to guide us through the scientific tools and systematic approaches that support air quality resilience, including monitoring system, policy frameworks, and how forecasting can integrate with early warning and DRR systems. Over to you.
Hi, thank you, Sanchita, and thank you for having me here. So, I think Ananya has already set the context of today's conversation, and she has rightly mentioned, air pollution is a widespread issue. It's not just related to Delhi and NCR. Rather, if we look at the spread of a pollution all across India, almost 80% of the Indian cities, they normally breach the national ambient air quality standards for PM10. So, let's start with the basics first. When we talk about national ambient air quality standards, so I'm sure like everybody must understand that, what are these national ambient air quality standards, and, how frequently have they been updated. So, the first national ambient air quality standards were formulated in the year 1982, uh, and the Environmental Act was formulated in the year 1981, and then thereafter it has gone into a several series of revisions, and the last revision has been taken place in 2009, where the list of the national ambient air quality standards have been extended to include 12 pollutants, uh, you know and even in the earlier standards there were the discrimination. There were different standards for the different reasons. For example, in case of the sensitive zones, the standards were little stricter, while for the industries the standards were leaner. So with the 2009 notification, what happened is, all the standards were made very much uniform, so that the similar standard will be applied to the different land use and the land cover categories. Well, I have a short presentation and I can share that so that the things become more clear. Yep. So, in 2021, just a minute, yeah. So in 2021, World Health Organization, they have released a new standards, which are much not standards, rather guidelines which are much more stringent as compared to the Central Pollution Control Board's standard. And normally these standards are being formulated so that taking into consideration the health impacts the different pollutants will have on human health, and at the same time what is the preparedness of the industries, because in order to control air pollution, right, there are different sources which are contributing to the problem of air pollution, and they need to get promoted to the cleaner technologies. So to get promoted to the cleaner technologies, industrial preparedness also plays a very important role while we define national ambient air quality standards. That's how we define national ambient air quality standards. So, like, in order to know the state of air quality, what is happening around us, what is happening across the country. So we need to carry out ambient air quality monitoring. And there are the different methods to carry out monitoring. The one of the basic method that has been conducted and that has been utilized since the inception of the National Ambient Air Quality Standards is the manual monitoring stations, and these are categorized as NAM, which is National Ambient Air Quality Monitoring Program. The second set of stations are the online stations, which are widely being utilized by different city authorities all across the countries, and these are the CAQMS, which is basically continuous ambient air quality monitoring stations. The third category of the monitoring method could be the low cost sensors. This is not a regulatory grade air quality monitoring method. The data of the low cost sensor cannot directly be compared with the national ambient air quality standards, because the sensors that are being utilized, they sometimes behave very notoriously. So normally low cost sensors can provide you a trend analysis, whether the air pollution is increasing in your surroundings or it has decreased over the years, but you cannot directly compare the low cost sensors values with the regulatory grade sensors, or with the national ambient air quality standards. Normally, that's not a right method to do that. The fourth is a satellite based monitoring. So normally, when we talk about a well-versed and integrated monitoring system, what different countries try to do is they try to integrate the data of the manual monitoring stations with the online monitoring stations, low-cost sensors, and the satellite-based monitoring to do the data triangulation in order to make sure that whatever values they're reporting, they are being duly checked through the different methods. In India, we are primarily doing manual monitoring and the continuous ambient air quality monitoring. Different agencies have installed low-cost sensors. Different agencies are also analyzing the satellite data, but these are not regulatory, promoted methods of air quality monitoring, and the data is not being integrated anywhere in our country. So this graph simply shows, the growth of the manual monitoring stations over the year, and the next graph basically shows the growth of the continuous ambient air quality monitoring stations over the year. And like India has one of the most diverse air quality monitoring network with over 1,200 plus monitoring stations. But still, there are gaps. Most of these monitoring stations are being located in the urban cities, and we have almost no or the limited monitoring in the rural area. So, which is one of the major drawback of our air quality monitoring system that is being established in Indian cities. This is, some of the analysis. If we look at the spread of a pollution in the different parts of the country, definitely, as Ananya has also mentioned, that, the Indo-Gangetic Plain, which is primarily, the northern part of India, is facing a more critical air pollution in terms of the PM10 and PM2.5 concentrations, while the northern cities faces, a most burnt of air pollution. But the situation is also equally bad in the eastern and the western part of the city. So the southern part of the country is still much better because of the prevailing meteorological conditions over there. That basically, that basically facilitate the better dispersion of a pollution in those cities. That is why we don't see much of a higher concentration. Ananya has also touched upon, sources which contribute broadly contribute, to the city level air pollution. So, like normally when we talk about city level clean air action plans, and we wonder, why there are the different clean air action plans for the different cities. And the reason is simple, that the sources which are contributing to the different cities are different. So when the root cause is different, so we need to have a different air quality action plans for the different cities. For example, here I am showing results of the 3 source apportionment studies that are being done by Terry. And we can clearly see, while in Lucknow, if we will see, the residential sector is contributing the most, followed by the road dust and transportation. While in case of Nasik, we'll see, vehicle, industry, and the waste burning are the equal contributors. And the right hand side graph shows the distribution of the sources in Pune. And in Pune, it's primarily transport and road dust which dominate the pie. So we can't have a one shoe fitting to all the city. So that is why we need to have a different city level clean air action plans focusing on these specific sources, so that the air quality within the cities then can be improved. So we have also done a review of the different clean air action plans of the cities which are being prepared by urban local bodies. And what we found that in most of the cities, the key sectors that are being focused upon are augmenting better air quality monitoring network within the cities. Uh, there were lots of measures related to the transportation, some related to industry, road, and waste. So, if you see, like, there is a lot of dominance of the localized sources of pollution, while if we talk about a city level clean air action plan, still they miss the component of the regional air pollution, and which plays a very important role in order to tackle the city level air quality problems. So in case of the transportation, the standards were primary, the interventions in the clean air action plans were primarily looking into the control of the vehicular emissions via fuel standards, public transportation, cleaner technologies. In case of the industrial sector, most of the interventions were focusing on the regulating industrial emissions, brick kilns, continuous emission monitoring systems, tracking, which is like better monitoring of the stack emissions from industries. In case of the waste management, it was the control biomass burning, improve waste collection, and promote recycling. While in case of the road infrastructure, it was suppress dust with the improved road design, mechanized sweeping, and maintenance, and the addition of the green spaces within the in the different parts of the cities. And these are some of the city specific measures which are there. So like the problem of air pollution is not new, and it is not being generated in the last, I would say, 5 years or 7 years. As we have seen, we had the national ambient air quality standards even in 1982. So the problem is not new. And when the ministry realized that the problem is also not related to only Delhi and NCR, rather it is widespread across the country, and many of the Indian cities are facing this problem. As a result, the National Clean Air Program was launched in the year 2019. And at that time, the Central Pollution Control Board analyzed the data for the PM10 levels, because at that time only the monitoring network was there in the country for PM10. There was no monitoring network for PM2.5. So we did not have enough evidence to form policy for PM2.5, which is one of the major lacuna that National Clean Air Program is currently facing. So the primary goal of the National Clean Air Program was to achieve a 40% reduction in PM10 levels in 130 targeted cities by 2025-26, with 2017 as a baseline year. So what they did is they tried to analyze the continuous 5 years of a data for PM10 concentration for all the Indian cities where the monitoring network was there. And they tried to look at the data, number of the cities which were consistently violating the national ambient air quality standards. And then they renamed those cities as a non-attainment cities. So basically, non-attainment cities are those cities which do not meet the PM10 air quality standard for the last 5 years. They will be fall under the category of the non-attainment cities. And as per the Central Pollution Control Board, in the country there are around 130 non-attainment cities. If you look at the overall, objectives of National Clean Air Program, so it was primarily to strengthen the monitoring network, to strengthen the public outreach and awareness, and to implement the feasible sector-specific interventions. Again, they were saying feasible sector-specific interventions, but there was no clear demarcation of, implementing the sector-specific intervention at the different scales and at the different rates. So what do I mean by at the different rates? For example, when we talk about, large scale industries. Large scale industries can't be controlled at a city level, rather, a national level approach is needed to control emissions from large scale industries. There was no clear cut guideline that how those emissions would be regulated. When you talk about residential sector emission, most of the biomass burning in the cook stoves happens in the rural areas. It doesn't happen in the urban areas. Either it happens in the urban slums or otherwise in the rural areas. There was no clear cut, targets for the LPG penetration in the rural areas. So similarly, if you look at the sector specific interventions, the National Clean Air Program did not provide any clear cut guidelines on that. Now, after the launch of the before the launch of the National Clean Air Program in 2010, the SUFFER system was launched, and this was launched by the IITM and the Ministry of the Earth Sciences. So, and the objective was to increase the awareness among general public regarding the air quality in their city well in advance. So, the SUFFER system is one of the air quality and the weather forecasting and the research system, and it tells you about the overall city pollution, location specific air quality, and a relative contribution of the different environments in a city. So if you want to know, what is the air quality index at Wazirpur in Delhi, we will go to the SUFFER and we can actually get the forecast from SUFFER system for the location specific forecast. So this SUFFER system, it is being there in 4 cities, Delhi, Pune, Mumbai, and Ahmedabad. It provides information for the 4 cities. And what they have done is they have set up observational stations in these 4 cities. And on the basis of these monitoring stations, they forecast, they train their model, statistical model based on the AI and ML. And that is how they forecast the air quality for the next 3 days. Yeah.
Sorry to interrupt, ma'am. Can you please wrap up in 1 other minute?
Yeah,
Minute. Yeah.
sure. So the second air quality early warning system was also built by IITM, and that was built in collaboration with IITM and IMD. And this is operational since 2018. And, this new early warning system is basically using emission inventories and the chemical transport models in order to forecast air quality concentrations. And this provides you at a city level, what is going to be air quality in the overall at a Delhi level in the next 3 to 10 days. And this is currently being utilized by government to, to put in grab restrictions in Delhi and NCR area. And this is a, further refined version of the SUFFER system that was initially being, developed by IITM. And this provides a forecast not only for the 4 cities, rather a much larger area within India. Now, when we talk about air quality index, air quality index does not show anything in terms of the concentrations, rather it converts concentrations into values which are being easily understood by the general public. So it basically, converts the pollution concentration values into indices and define those indices as, at if the value of the index lies in a certain range, the air quality category would be good, means that it is not going to create any health impact for all level of the citizens. While if the air quality falls in the satisfactory level, so maybe guidance would be issued for the vulnerable section of the society, such as elderly and children. Similarly, for the moderately polluted, guidance would be issued for the vulnerable section of society. For poor, very poor, severe, it is bad for every citizen in the society, and the guidance, health advisory guidance would be issued. So primarily, it is based on the sub indices of the different pollutant, and we always take a worst case scenario. So the pollutant which is showing the worst, the highest sub indices, is always being considered as the air quality index that represents the overall scenario, that if you control that pollutant, the sources of that pollutant, everything, the situation will become normal, because everything is being integrated. When we burn, say, biomass, it's not only PM that gets released from the biomass, right? It's also NOx, it's also SO2, it's also volatile organic carbons that are being released from that biomass burning. So if we control those sources, so it's not only PM that will get regulated, it will rather be other pollutants as well that will get regulated. So we always work on a worst case scenario perspective, and look at the highest subindex of a pollutant and try to work on the sources of a pollution for that particular pollutant. So yeah, that's how it works. Yeah. Thank you.
Thank you so much, ma'am, for such rich technical insights. Your explanation on air quality standards, focusing on NAAQS, monitoring methods, growth of manual monitoring station over the years, key sectors in clean air action plans, NCAP, suffer system, which is tremendously valuable and adds immense clarity to how science and policy must work together. Thank you so much, ma'am. Moving forward, session three. For session three, we have two distinguished speakers with us today. We are pleased to welcome Dr. Arun Kumar Yadav, Program Manager, Enviro Catalyst, and Mr. V.R. Raman, National Convener of the Public Health Resource Network. Uh, we will begin with Mr. Dr. Arun Kumar Yadav, sir, Program Manager at Enviro Catalyst. Sir brings the extensive experience in implementing multi-sectoral clean air and climate projects, particularly from his work as project coordinator at UNDP India, where he collaborated closely with MOFCC, MOHFW, Pollution Control Board, and ULBs. His work includes integrating data driven air quality solutions into city action plans and supporting institutional coordination for sustainable outcomes. Sir, we invite you to share your reflections on strengthening partnership among government, academia, civil society, and local bodies to drive coordinated air pollution mitigation. Over to you, sir.
Hello.
Hello. Yes, sir, you are audible, sir.
Okay. I'd like to thank Fair India for inviting me to such a for this lecture, and the topic which assigned to me is I think my screen is visible to everyone.
Yes, sir, it is visible clearly.
Under multi-sectoral coordination for air pollution mitigations in India, and national and city level approaches. So as we all know that in India, almost 18 cities, almost 17 to 18 cities are most polluted out of 20 cities in the world. And air pollution is not a seasonal phenomena; it's actually round about throughout the year. And these are the basic details which already covered uh, by the Dr. Anju and Ananya as well. So in major contribution is come from the either from the transport industry, agriculture, or the waste. Actually, these are the percentage. The contribution is vary from the region to region and the city to city level. And for the for the at India national level, there we have some institutions at the national level, like who actually governing the pollution, air pollutions, like the apex bodies or the MOFCC, and the which actually regulate and law and, related to not just air pollution, all environmental laws come actually designed and regulated uh, under some framework of it come under the MOFCC. Then the CPCB Central Pollution Control actually work under the MOFCC and the recent the all other actually other bodies from the national level related to environment work under the MOFCC. So then actually the Commission of Air Quality CAQM, which is actually initiated by the guidance of the judicial intervention, the CAQM, which actually regulates the air pollution law in the not just the in NCR region, but including the five states near the Delhi. And the other aligned ministry who like the Ministry of Transport or the Housing, Urban, and the Ministry of Power, etc. They are all actually all are actually work at the national level to for the under air pollution law at the state level. So we have under state government, the State Pollution Control Board actually who actually work who actually state whichever the guidelines from the we receive from the center to state. Actually the State Pollution Control Board actually have to give the technical input to the district collector offices. And so at the we see at city level we have some local urban local body or municipal corporation who have already which work at the ground level and implement whatever the law and the policies which are designed at the state or national level, actually regulated at the on ground by the ULBs or municipal corporation. And same time the city action plan which are developed by the signed for city specific, actually they also regulated at the by the ULBs. So other than this, we also have some joint task forces or cross-sectoral engagement which help into enforcement and monitoring of the law. Actually, we have clear role and responsibility when we see the these all institutions. We have roles and responsibility which help in decision making. And when we discuss about the alignment at the national or sub-national frame come in the framework. So at national level, we have from the starting from the Air Act to the EPCA, then ANCAP or something. So after that, these all actually come from the air quality governance actually structures is designed in such a way that at the national of national to state level and then transfer to the state center to uh, the air quality governance structure is designed in such a way that the from the national level center set policies direction and state regulate and enforce them, and city actually implement to these action on the ground. For the monitoring alignment, we have CPCB or SP State Pollution Control, who actually jointly monitored, and city feed the real-time data to the system. And the funding allotment when come out like the funding like the NCAP, and when we talk about NCAP, the funding from the MOFCC to the state to the city level, and these 15 as per the 15 Finance Commission, from the fund is from the Ministry of Finance to the state, and state to the ULB level. So. So these are actually the framework under which the governance structure actually work in India. And on ground we have on paper we have already have very beautiful framework who actually supposed to work, but somehow when we see the outside, the still we are facing the very poor to severe days. The AQI most of the time is almost about 300, especially in the North IGP belt. So like the role of responsibility of the partnership among the government. So academia provide when we actually do this whatever, including the other institutions like the government, academia, or civil society. So academia provide research, and they can provide they are continuous like the IITs or some other institutions actually even they also done the source portion study for the Delhi wealth, and they actually then present the data in such a way that can be help to state for the SPCV or city action states, or the uh, then actually help to provide to a state pollution control, which help to the municipal corporation regulate that better way. In case of NGO or civil society, awareness help to take the action, city actions to help to technology adoption, like the low cost sensor. Low cost sensor can be one of the solution, but it's carefully the sensitivity and the accuracy is always in doubt. So, and we have multi-sectoral forum, public advisory panel, or capacity building workshop is continuously taking to stakeholder for the better collaboration on the ground actions. So mainly like the challenges what we are facing, the overlapping mandate, like the some max in actually the rule the laws actually set, but the mandate are not very clear. So some of the action like and the mandate between the state pollution board or the especially ULB case, in case the they always the on ground when we see the mandate are not very clear, or which agency will take action, or and whom's responsibility. So it very not clear, and same for the data gap, till now out of 131 cities, 28 cities are not have and like CAQMS stations, or but it's supposed to be done 2 3 years back when the NCAP started in 2019. But still, the number of cities are not have any CAQMS continuous air quality monitoring stations, and resources limitation at both national or state levels. Like the most of the state pollution boards, they have lack staff. Almost 50% of their staff vacancies are still unfulfilled, and the state pollution control not able to actually they are so much they already assign so much work, actually regular work, so they are not work as innovative way to tackle the air quality or other challenges. And uh, s- uh, and there for this I think this academic institution, they can play important role. They can even opportunities when talk about the opportunities, integrated data platform, whatever the data is come from the different stations, like we have CPCBCR systems where all data come, but there are still their data accuracy, and some part is still doubtful. And when local innovations like the low cost sensor and technology can be adopted, and community monitoring, more engagement of the community at the RWA level or some university level, they can also be take consider into this for the help in the air quality monitoring, and improve for like public participation, like the this role can be done by the all NGOs and all of civil society organizations have to bring the health data as well. So say a lot of study already done, which clearly indicate that how the air quality is impacting the human health. But when we go outside, then see most of the people actually they are aware, but they are not, um, somewhere I think awareness or some they are not very much participate to to help to clear the air. And so indicator based financing rather than as per the NCAP guidelines, they say that 15% NCAP on 15 finance is almost 10 to 15% reduction of air PM10 level. So every year, but when we indicate, but and when we actually regulate these guidelines to state cities to if just for one particular city is actually the friendly guidelines is say that 50% reduction should be done every year, but for getting the next tranche. So, but if particular cities are done some good work, but the as we all know that the almost depend on the season, but 50 to 60% pollutions come from the outside the city boundary. So their funding maybe they done very pretty well to regulate the pollution sources, but maybe their whole number of days PM10 PM10 reduction maybe 15, not 15%, but their next funding will be impacted. So same for the other cities as well. So the funding should be on activity based rather than rather than reduction based. And we need to approach not just city specific. We need to approach the bigger airshed approach to include the other jurisdictional. When we all know that air pollution is not any geographical, it's not a political boundary, but it's a geographical boundary. So include the airshed approach rather than city specific. Include the all nearby no, nearby areas, sub-city, suburban areas to when we frame the policies. So these are the some opportunities which can be adapted in the next NCAP. So and say one last thing, when not just PM10, we also need to include the PM 2.5. Actually, there's more health in terms of. So thank you.
Uh, thank you so much, sir, for sharing your insightful points on coordination, stakeholder engagement, and building actionable uh, points and bridges between policy and implementation. Uh, Raman sir is currently facing some issue as he's traveling, so I guess he will be joining later on. So with us, uh, we have with us Miss Raj Mariwala for session 5, and we are taking that session a bit ahead. Uh, Ma'am, if possible, can you present the session? And I will start by introducing her first. So it's our privilege to welcome Ms. Raj Mariwala, Director of Mariwala Health Initiatives. R- She leads one of the India's most prominent organizations working on accessible mental health for marginalized communities. Her work increasingly focuses on intersection of climate justice and mental health, and she serves on advisory board of several rights-based organizations. She's currently on the advisory board of the Misfit, a trans youth led organization, and Parcham, a feminist collective working with marginalized women and girls. We are honored to have you, ma'am. Over to you.
Hello.
Yes, ma'am, you are
Yeah,
audible.
yeah, I'm audible, right? I will
Yes.
just want to, before I start speaking, I want to just put up my PowerPoint. If you just give me a moment.
Sure, sure, ma'am.
Air pollution. Okay, I hope this is visible now.
Yes, absolutely visible.
And it is in full format or not as yet?
No, ma'am, not yet. You have to put it on the slideshow mode.
Just 1 second. I think I'll have to do that from my browser. Bear with me since I'm not used to doing this from my browser.
No worries, ma'am. Please take your time.
You can just click on the slideshow option.
On the slideshow option in my browser, right?
Right.
Is this working now
Yes, ma'am, it's visible.
as a
Is
slideshow?
not yet, ma'am. You might find an option of full screen. Yes, it's there.
Okay. Maybe I'll do this without and go over the main bits because then I can't access my notes. So I will stop the share and anyway, I think for maybe some of the statistics I can share with you all later in my wrap up. But good afternoon. Thank you for having me here. Interestingly, I'm actually unwell because of air pollution. But before I go into major details, I wanted to share some numbers about air pollution and mental well being and what these numbers tell us. And of course, a lot of this data does not come from India, unfortunately, but it is important for us to know anyway. Now, air pollution has been linked to certain mental health outcomes, especially for childhood and emotional health of children. So, every extra day above safe PM 2.5 levels is linked with a standardized increase in symptoms such as anxiety and depression in children. And these effects can persist over time even if PM 2.5 levels go down. There is also a long term mental health risk when it comes to long term exposure of PM 2.5 because it increases the risk of multiple psychiatric conditions such as schizophrenia spectrum disorders, depression, and anxiety. Now, studies in China, when they were facing heavy pollution, showed that short term increases, such as bursts of PM 2.5 and nitrogen dioxide, were associated with higher psychiatric hospital admissions, and this peaked especially amongst older adults. Right? So, for example, a 10% increase in nitrogen dioxide is linked to a 5% increase in hospital admissions for mental illness. This is even more so for adolescents. Now, India has a high number of young people, and it showed mood disturbances and internalizing emotional symptoms amongst teenagers. So, this is in higher PM 2.5 levels, okay? But overall, I mean, these are just some numbers for us to, I think, situate ourselves. But if we have to talk about it beyond just numbers for disorders, if we have to talk about it beyond what goes on as a pathology and as medical statistics, PM 2.5 nitrogen dioxide affects everyone's moods, clarity of thinking, relationships, and a sense of safety. So, in that sense, air pollution is, yes, you know, an environmental crisis, but it is also a mental health crisis. And it does affect everyday mental well being. So, in terms of our mental makeup, most people don't experience pollution as a disorder, they experience it as shorter patience, foggy thinking, headaches and irritability, difficulty focusing, lower emotional energy, and feeling trapped indoors yet unsafe outdoors. Now, none of this needs to be pathological, although I've already shared some numbers with you about the pathologies. It is, however, a very natural human response to the chronic strain of air pollution. And in that sense, pollution increases the mind's baseline stress. With air pollution, the brain works harder with fewer resources, and this literally, obviously affects how we work, study, make decisions, care for loved ones, and of course, manage interpersonal conflicts. So, just as an example, women who work in informal work, such as street vendors, waste collectors, domestic workers, often have no option but to avoid this exposure. And for them, they're a vulnerable population which becomes even more vulnerable due to the chronic stressor of this air pollution. So again, we don't have data for India, but a recent survey from Pakistan found that 70% of young urban residents reported worsening air quality, and many linked it to mood changes, anxiety, fatigue, and sleep disturbance. Now, despite this awareness, only about 12% actually used protective behavior such as masks or purifiers. And for mental health, this experience shows that it's not just about mental stress or feeling bad, but really pollution enters everyday experience and shapes mental coping and erodes one's capacity to act. Now, why do I say this? A major study in Lancet Planetary Health found that on days when pollution spikes, older adults are more likely to need emergency psychiatric care. Not because pollution causes illness. Now, we have to be very careful here. This is not about causality because that's very hard to prove. But what we do know and what data does show is that it strains the coping capacity and emotional resilience of older adults. Now, again, this is very relevant for India. As our population ages, it is only going to get worse and worse. And another similar large study found that years of exposure to polluted air increases the chances of developing psychosis-related problems, especially for those living in high stress, high pollution neighborhoods. So again, think about neighborhoods that are in more vulnerable areas, in informal housing, those who work in informal labor. The chance of developing psychosis related problems is much higher. Now, you combine that with the fact that certain populations already have a high chance of psychosis, such as homeless populations. Now, add to that years of air pollution exposure, and we are magnifying the chances of increased psychosis in that particular population. And of course, these findings are all aligning with what is happening and what we are hearing on the ground in terms of mental health. People are feeling more overwhelmed, more irritable, more fatigued, and more mentally drained when pollution levels rise. So I want to take one example, right, from the examples that I've just shared. And I want to speak a little bit about dementia, because we do have an aging population. Our young population is going to grow old. Again, studies have shown that there's a link between dementia and air pollution. But again, I want to be really very clear. Air pollution does not automatically lead to dementia. But long-term exposure to air pollution can and does speed up cognitive aging, especially in older adults. This includes forgetfulness, slower thinking, difficulty managing daily tasks, reduced confidence in moving around and socializing. And why is that? What are the pathways? Pollutants like PM 2.5 can enter the bloodstream, can reach the brain, and cause low-level inflammation over many years. And this gradual wear and tear can make daily functioning harder. And this is particularly for for elders living in crowded, under-resourced areas. Now, this is a ticking time bomb for us looking at our population demographics. And this is not just, a health issue, a mental health issue. It is also an issue of dignity, because aging well is really dependent on memory, independence, and connection with others around you. I do want to take another example to underline the risks of pollution, air pollution, and that is suicide risk. And it's an environmental burden that we rarely name. Now, again, India as a whole is a country in the world that accounts for a higher percentage of loss from death by suicide. Our young people, one of the leading causes of death is death by suicide. So it is very important that we talk about pollution and suicide very carefully and without sensationalism. Now, again, I want to really stress pollution does not cause suicide. But studies show that after sudden spikes in air pollution, sleep worsens, physical discomfort increases, irritability rises, and emotional thresholds sink. So, for people already stretched thin, it could be by financial stress, by caregiving burden, by lack of housing. A bad air day can actually be something that tips them over the edge. And this is exactly what they found in China, that there was a correlation between pollution spikes and suicide rates. Conversely, when China put in policy measures to decrease air pollution, they found suicide rates decreasing as well. Now, understanding this is very important because it helps us see suicide risk as not only an individual issue, but as a public health issue, as something shaped by the environment, inequity, and stress load that air pollution causes. Right? And again, in terms of the Indian scenario, suicide is a public health issue that is urgent for us to address. Now, while I've given you examples on dementia, on suicide, and I've also shared examples of certain communities that could be vulnerable, such as informal workers, such as homeless persons. We all know that even though air pollution, we all experience it. And in fact, in the beginning, I spoke about what can happen to all of us in terms of difficulty concentrating, difficulty focusing. There is still unequal exposure to air pollution and thus also unequal impact. It doesn't blanket cities equally, right? What makes it worse? Air pollution and mental health concerns are worse for those who live in informal housing, worse for those who live in industrial belts, worse for those who live in migrant worker settlements, and definitely worse for women where they earn their livelihoods outdoors. Now, unfortunately, these are also the same areas where people have the least access to healthcare, least access to green spaces, least access to cooling environments, and least access to mental health resources. So overall, if we have to look at the mental health toll of air pollution, that toll is actually deeply unequal. And air pollution in that sense, just like that study in Pakistan where they said that 70% is affected, but only 12% is using a mask or an air purifier. That is not accessible to many in the examples that I just shared, right? And what are the policy implications of this? What can we use? Like I said, a lot of the research has shown the connects to schizophrenia, depression, anxiety disorder. What we don't know is also enough of the positives. How much of green spaces can help with air pollution and mental health concerns? How do we include that in policy? Because it is very important to include this in policy as well, right? So it is critical that we look at this and use it to inform policy so that we can say that even small increases in air pollution have measurable effects on emotional, cognitive, and psychiatric health across the lifespan of individuals. Now, what are we going to do as, say, mental health advocates or those who work in public health? One is, it's very clear that in policy, we need to treat clean air as mental health infrastructure. Even if we look at something as serious as suicide and the correlation to suicide, we need to tell our policymakers that reducing pollution protects attention, patience, memory, sleep, and coping capacity of individuals. And this is especially critical for children and elder adults. We also need to put in place separate supports for older adults who are at risk of developing psychosis or memory related deficits. So it could be warning solutions so that masks or other mitigation measures can be carried out, support groups, neighborhood level elder care. There is a need to protect women and informal workers, be it on Narega sites, be it sanitation workers, such as work timing changes, again, easy policy shifts that can be made, shade and shelter, protective gear, maybe paid sick leave. Uh, I cannot stress this enough. Rarely is mental health and mental health arguments used as part of climate and urban planning. These are very important if we are to reinforce the policy urgency of the same. And we need to look at heat, housing, transport, waste management, and air quality as all shaping mental well being, and to make the case for policy advancement for the same. I cannot stress again enough the need to involve communities directly, whether it is neighborhoods living with worst air who can guide the monitoring, whether youth volunteers in these systems can go around and check on the elders. It's very important to have a community level approach to the mental health ramifications of air pollution, because integrating mental health into DRR, public health, and community action is going to be critical if we are actually going to address air pollution and its effects on mental well-being. Like I said, this is a chronic exposure that affects each and every one, including in loss of sleep quality. I think the other group that I haven't really spoken about but is important to speak about is persons with disabilities. That is the largest minority in the world. And it is very important for the health of persons with disabilities who are, in fact, even multiply marginalized when it comes to air pollution, because the mental concerns of persons with disabilities and combined with the health impacts of air pollution, be it on asthma, be it on other people who are suffering from NCDs, is multiply marginalized, multiply magnified, leading to higher health costs. I do want to put up my PowerPoint just very briefly. If you just give me a second. Sorry, how
Ma'am,
much time do I have left?
yeah, ma'am, regarding that, can you just wrap up in another 1 minute if it's possible?
Yes,
Yeah.
I will wrap up in another 1 minute. I am okay. I don't think I'm going to be able to do this because I wasn't. Oh, okay, here we go. View slideshow mode. Is it visible now as a slideshow?
Yeah, yes,
Yes.
yes.
So again, to wrap up, there is a stress from chronic exposure that is very important. The difficulty focusing, headaches, irritability, low mood. Yes. Again, I just wanted to put this up there. I want to reiterate, we do not have enough information to say causality. We do know that air pollution combined with noise pollution makes it much worse. And it adds a burden to already at risk individuals, which is going to be critical for India to look at. I will share, this is essentially what I spoke about. What I will share in my comments is all the resources and all the data that I have used to share this information with you. Thank you. I'm
Uh,
done.
okay. 1 second. Thank you so much, ma'am, for highlighting the important mental health dimensions, psychological conditions on children, adolescents, teenager, as well as adults due to air pollution, the cognitive effects, and an area which all like overlooked but deeply intertwined with community well-being. And lastly, you also highlighted that we need to include the community well-being and upbringing the community actions, and lastly focusing on the persons with disabilities, which is very important in today's times. Thank you so much, ma'am. Uh, our last speaker for today's session, uh, we are honored to welcome Mr. Himanshu Shekhar Mishra, Senior Editor at NDTV India, who has over 2 decades of experience reporting on parliament, national policy, disaster management, NDMA, and climate related issues. A member of Oxford Climate Journalism Network and author of multiple research papers, he brings a powerful communication and public awareness perspective to today's theme. We invite you, sir, to speak on role of media, digital campaign, citizen monitoring, and community engagement in shaping behavior change for clean air. Over to you, sir.
Yeah, yeah. Am I audible?
Yes, sir.
Yeah. Thank you very much for this opportunity. In fact, the title of this interaction, Invisible Disasters, cannot be more contextual in the sense that we know that pollution is having a devastating impact on human lives. Every year we suffer, especially in Delhi during this season, but on the ground, we do know that all the effort that is being made has led to some reduction in pollution levels, but the crisis remains on the ground. I wish to start with some important facts about the stubble burning. Now, this has been part of the discourse on pollution since this crisis started a few years ago. And I was just looking at the data, the latest data released by the uh, the Green Slab, which is a part of the Indian Council for Agricultural Research, Indian Agricultural Research Institute's campus, has in fact revealed very startling facts. I just wish to start with those facts. On 17th November, the data that is released, the latest government data on Parali burning shows that the number of residue burning events, that is, the stubble burning incidents, was 1,351 on 17th November. Uh, 17th November, there were 31 incidents recorded in Punjab, 10 in Haryana, 384 in Uttar Pradesh, and the highest 822 in Madhya Pradesh. Now, we do know that in Punjab and Haryana, a lot of effort in recent years have been made on addressing the challenge, the crisis that is created by parali burning, especially during this season when farmers are readying their field for Rabi crop sowing. This crisis erupts at this time. But interestingly, while the numbers are higher, it was 1,351. If you just look at the last 4-5 years data, it shows that numbers, in fact, are far less now than what they were 4-5 years back. Just look at the number of Parali incidents in Punjab, for instance. In 2020, between 15th September to 17th November 2025, the number of Parali burning incident was 80,346. Now, this year, it has declined to 5,003. So it's a huge decline from 80,000, more than 80,000 Parali incidents to just 5,000 this year. In Madhya Pradesh also, the number of Parali incidents was 12,479 in 2020. It has declined to 8,876 now. And that clearly shows that all this effort that has been made in recent years to address the issue of Parali burning, of course, has produced good results. But on the ground, I think the local sources of pollution have increased in these 4-5 years, and that's why the corresponding benefit of a very sharp decline in Parali incidents, especially in Punjab and Haryana, is not reflected in the pollution levels. Just look at the Diwali data, the day from when the crisis this year actually started, the smog incidents. I was just looking at the 5-year data to get a perspective on what has been the impact of all the effort that has been made to curb pollution, and the reason why there is a need to launch a campaign to sensitize different segments of the society, which is the primary subject of my interaction. I'll come to that, but just looking at the data in 2021 on the Diwali day, the AQI level was 462. Next year, it reduced to 302. In 2023, it was 358. In 2024, it was 339. And this year, the AQI level on the day of Diwali is normally counted 4 p.m. on the day of Diwali to 20th October, and 4 p.m. of 21st October was 351. So very clearly, it shows that while in terms of comparing it from 2021 data, there is a decline, but the AQI level was suddenly spiked to 351 on the day of Diwali. And that clearly shows that while all the effort that is being made on the ground in terms of addressing Parali incidents, the numbers, of course, have significantly declined. But on the ground, the crisis remains because the local sources of pollution have increased in this period, and experts have said that more than 50% of Delhi's pollution is created by vehicle emissions. That is one issue that several governments have tried to address, but not much outcome actually is visible on the ground. And that is why there is a need to work more on community resilience and risk communication systems to ensure that uh, national capital and other prominent cities in India can get some kind of clean air. Now, in terms of how information and media shapes behavioral change, clearly we know that especially during the COVID crisis, the the effort that was made towards crisis communication did produce results, though it was a Herculean task to actually sensitize 1,400 million people to actually follow a protocol during COVID crisis. But that is also the challenge that we face when it comes to pollution. And I just want to share one case study that was followed in China. In 2013, the Chinese government rolled out an air quality monitoring and disclosure program. And this was an attempt to provide citizens with real time air pollution information from over 1,400 monitoring stations across China. And the outcome, as we know now, dramatically increased households' awareness of pollution issues. And it led to behavioral changes in terms of common citizens taking steps to mitigate the health impacts of pollution. And this of course, then now we know that China has been hugely successful in terms of not only sensitizing people in how they can protect themselves from pollution, but also addressing the larger sources of pollution. Uh, that campaign, national level campaign that was launched, not only led to a significant behavioral change among the citizens, but even the media was far more sensitized. And in fact, the researchers now notice that the number of stories that were being published in media, on television stations, on newspapers, there was a significant increase in that. And of course, the word smog also, as researchers found, became more prevalent on social media platforms. And then there was an increase in searches on internet on issues related with pollution, and that I think is something that needs to be done in India also. Though we do see people using masks now in public places, 4 5 years back, before COVID, that culture did not exist in India, and we rarely saw people using masks in public spaces, especially during November and December season, which are considered the peak season as far as pollution is concerned. But these kind of behavioral changes needs to be strengthened. We do know that, especially in NDTV, we are especially focusing on pollution. It has been one of the top stories for us, and I've done several stories on Parali burning and its debilitating impact on Delhi's pollution and on human health. But I think considering the fact that despite all these efforts, the pollution level remains high, and we know that the GRAP 3 is now in force in Delhi, that clearly shows that despite all the Herculean effort that has been made on the ground, the challenge to deal with pollution remains on the ground. I also believe that when it comes to digital campaigns, journalism, and citizen monitoring, I think the advancement of new communication technologies, the advent of new social media platforms has actually expanded the media space. And considering the fact that around 100 crore Indians now have access to a smartphone, they have access to internet. India today is world's largest digitally connected democracy. So it would not be very difficult actually to launch such national level campaigns in terms of sensitizing citizens through these digital media campaigns, especially on social media. And as I said, the fact that around 100 crore Indian citizens now have access to a smartphone, have access to internet. So it would be easier to actually weave them, carry this information to the people on the ground, and also sensitize communities and how at the social level they can also launch clean air movements in different parts of the country, and they can also use the advancements in communication technologies and utilize the power that digital transformation that India has undergone provides us. And then this can be used to have a very aggressive outreach campaign in terms of sensitizing people on how they can protect themselves. We need air quality management systems which are far more proactive, far more public centric, and also supplying air quality sensors to community residents. That should not be considered as enough, because data collection alone without support can lead to disempowering outcomes and erosion of trust. So I think we need to work far more than what we have done. We do see routinely wherever the pollution level goes up across country, wherever the pollution level crisis deepens, schools are immediately closed. I think it's very important to engage school children, college going students in these digital campaigns that we are discussing, because air pollution, of course, we know impacts children's health far more. It has a far more impact on senior citizens. For instance, it's very important that from a very young age, school children are actually trained in terms of how they can protect themselves from pollution, what needs to be done in terms of uh, building up a new lifestyle to sustain the impact of pollution. And of course, closing school can only be seen as a reactive strategy. We need to have a far more proactive strategy in terms of addressing the root causes of pollution as well. Uh, and especially those children and those youth who live near industrial cities, factories, and freeways, they need to be far more active in terms of sensitizing the community about the debilitating impact of pollution. This can also be part of the course curriculum, both at the school level and at the college level. And I think we need to have very intensive workshops and these kind of interactions that we are having now. We need to engage school children also in these kind of interactions where experts can go and have direct interface with students on the ground. So a lot more needs to be done in terms of making communities far more sensitive, and there is a need to launch a national digital campaign to actually engage communities and citizens and sensitize them about the important role they can play in combating pollution and how the mitigation measures can be initiated and launched across the country. Because we do know that last few years a lot of work has been done on the ground. Indian society is far more sensitive today than it was, say, 5 years back, when Punjab, a small state like Punjab, was recording more than 80,000 cases of stubble burning. That has reduced to 5,000 today, but the crisis on the ground remains. And that essentially means that the the overpopulation of India's urban sectors is clearly fueling this crisis of pollution. And we need to have a far more institutional response to address the challenge of pollution than what we have undertaken so far. So, with that, I will stop, and if there are questions, I'll be very happy to answer them.
Hmm. Thank you. Thank you so much, sir, for such deeply engaging reflections. Your emphasis on data-driven evidences of air pollution in India, the Parali accident, you focused on how we need to strengthen the risk communication system in India, role of social media, digital media in shaping public consciousness around air pollution has added an essential dimension for today's dialogue. Thank you so much, sir. Uh,
Thank you.
Moving forward, I would like to thank all the distinguished speakers for insightful reflections today. Your perspectives from recognizing air pollution as slow onset to strengthening forecasting, coordination, and community resilience and mental health responses have greatly deepened our collective understanding on this urgent issue. As we move to our final segment, we invite the participants to share any reflections, questions, or insights they may wish to contribute. Feel free to raise your hand or share your thoughts in the chat box so that we can bring you in the discussion. As I can already see, there are many questions that has been asked, and the speakers have also replied in the chat box. I can see few questions for Himanshu sir, which I will take it forward. Mr. Amit Kumar Giri has asked that what is the role of media in context of air pollution beyond AQI information and forecasting, which is still not explored and can be a crucial in tackling this burning issue.
Well, media has a central role to play of sensitizing disability, especially in those parts of the country where pollution has become a deep crisis. Media has a central role to play in terms of sensitizing people, in terms of sharing data, in terms of telling them the issues that I was trying to flag. That while a lot of media coverage 5 6 years back was centered on stubble burning, for instance. I remember lots of reporters went to the field in Punjab, in Haryana, and they would be doing live coverage from the ground zero where the parali burning was being done by farmers, including farmers on the ground. And all these efforts that were put in place in last 5 6 years in terms of putting in place legal measures, penal measures, punitive measures, all this collectively did produce good results. And that is why a state like Punjab, which had reported around 83,000 parali burning incidents, it more than 80,000 parali burning incidents in 2020. This year, the number is reduced to 5,000. So clearly, all this effort that is being made has produced good results. But we do know that while we were focused on external sources of pollution in Delhi NCR region, we now know that the real sources of pollution has in fact shifted inwards, and the internal sources of pollution have now become the biggest reason for the crisis that Delhi NCR is facing today. And so we need to work more in terms of how we can put in place year-long campaigns for sensitizing people. We should not wait for November, and we should not wait for farmers to start burning parali and then wait for a Diwali day to start reporting on pollution. I think we need to report on pollution even when the crisis on the ground is not visible. Because remember, if you're calling pollution an invisible disaster, there are three distinct phases of every disaster. There is a pre-disaster phase, there is a disaster phase, and there is a post-disaster phase. So we need to be very active in all these three distinct phases of a disaster. And I think the most important is to ensure that the disasters don't take place. And for that, we need to be far more active in terms of sensitizing people in the pre-disaster phase. That means when there is no pollution crisis is the time when we should be discussing pollution more than what we do now. And once we do that, gradually we will see there will be incremental change visible on the ground.
Thank you so much, sir. I guess that also answers Ms. Ashwini Singh's question on how media and civil society organization influence the government authorities to on ground implementation of the policies in regards to the Parali burning issue. Mr. Ashfaq Mohammed has a question that the citizens of Delhi organized a huge protest against the rise in pollution, which shows the community is very much aware of the suffering from the pollution. How to What is the role which is expected from the citizen in combating pollution, and how can the government also work on it?
Well, we do know that the GRAP 3 that is now in force in Delhi clearly makes it mandatory, uh, makes it mandatory for citizens to try and use public transport more. I remember reading the guidelines of GRAP 3 notification. It very categorically outlines how a citizen can contribute in terms of reducing pollution levels. And one of the first and important recommendation is that we should try and use public transport more and not use individual vehicles. I can also tell you that during our interactions in the Oxford Climate Journalism Network program, many journalists, in fact, even asserted that every time when they fly, they feel guilty because every time you fly in an aircraft, you somewhere contribute to global warming. So I think that level of sensitization is very necessary. Secondly, the GRAP 3 notifications also outline how citizens can protect themselves. It's only when it is very necessary that you should try and go out. We should all try and ensure that we work more from home than traveling outside. So I think in terms of not only ensuring that there is less emission on the ground, to ensuring that we expose ourselves less to the high pollution zones, the GRAP 3 notifications, I think, has specific recommendations on the ground, and we should try and ensure that we are far more sensitive to what GRAP 3 notifications are and what kind of restrictions they impose, and then try and follow those restrictions. And this is not only true in terms of what the factories should do, which are situated in and around Delhi NCR region, but also citizens should monitor what industries are doing, whether they are following the GRAP 3 regulations or not. And if they are not following, then a sensitized citizen can go to the authorities and complain about these factories and industries. So I think this is a collective battle. We are all victims of pollution, and we all have to work together in terms of making a significant contribution to not only mitigating this crisis, but also ensure that in future we are far more sensitive in terms of addressing the root causes of pollution.
Mr. Santosh Pandey has a question that is there any government program for spreading awareness among the school going children?
Well, we do see government advertisements in newspapers, on television.
Yeah.
We do know that disaster management agencies also launch digital campaigns on social media. But a lot of work is also being done by Central Pollution Control Board, for instance, by other pollution monitoring agencies are also again and again issuing advisories to the people. And I think people should also try and make an effort to reach out to these pollution monitoring agencies because they have the most credible information in terms of not only giving them credible empirical data on the level of pollution in the area where they live, but also in terms of how they can protect themselves. There's a lot of plethora of information on the web that I see, and it's not only necessary for a television news station or a digital media platform to launch campaigns. I think these government agencies on their websites have lots of credible information, and I think citizens should visit these platforms and try and get more and more new knowledge about how they can protect themselves from pollution.
Thank you so much, sir. For with this, we will thank all the distinguished speakers for the valuable contributions and invite participants to remain engaged as now we move towards the concluding remarks. Your reflection today reminded us that addressing air pollution is not just an environmental issue but it is a public health, governance, communication, and social justice imperative. So, thank you all for joining, and we look forward to your continued participation in Sphere India Academy's future sessions. Thank you, stay safe, and stay resilient.